Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Over the last 24 hours, we have identified 399 new cases of COVID-19 and completed about 10,400 tests. Our positivity rate currently stands at about 3.7%. We have identified 47 new cases of a variant of concern. This means that 734 of these cases have been identified since the first variant of concern was detected from a test sample from a returning traveller on December 15th. While any cases of a variant of concern are worrying, so far we have been able to slow the growth of these cases here in Alberta. In the past 6 weeks, the percentage of all of our cases has risen somewhat, from about 3% of all active cases in late January to about 9% of active cases today. Having said that, in other jurisdictions, they have seen a much more rapid growth of variants of concern as a proportion of all COVID cases, going from 3 to 4% to well over half of all cases in just 6 weeks. This means that our health measures, both the overall restrictions as well as the targeted measures for variant cases, are working to slow the growth, and if we continue to work together, we can continue to limit the spread. Looking to schools, there are active alerts or outbreaks in 259 schools, or about 11% of schools in the province. These schools have a combined total of 1,017 cases. There are 254 people in hospital, including 37 in ICU. Sadly, 2 new deaths were reported to Alberta Health in the last 24 hours. This leaves 2 more families grieving their loved ones, and my sympathies go out to them. My thoughts also go out to those who are in hospital or ICU, and to the families who are watching their loved ones battle this virus. Today, I want to talk about vaccines. Every day, there seem to be new developments about vaccines, new approvals, new shipments, expanded eligibility. And while this is all welcome news, it can be overwhelming to try and keep track of the latest information. To date, we have administered close to 309,000 doses of vaccine in our province. This includes more than 91,000 Albertans who have been fully immunized with 2 doses. I'm pleased to report that so far, close to 138,000 Albertans over the age of 75 not residing in continuing care or designated supportive living have been vaccinated or have appointments to be vaccinated. This is great news, and will go a long way in protecting those who are most vulnerable to severe outcomes from this virus. Today, we opened up appointments for the AstraZeneca vaccine to Albertans born in 1957 and First Nations, Métis or Inuit individuals born in 1972. As we anticipated, AHS has experienced high demand for appointment bookings since launch at 8 o'clock this morning. As of 2:30 p.m., more than 11,500 eligible individuals have already booked their AstraZeneca appointments, including 1,800 through 811. Immunization appointments continue to be available in all AHS zones. As you know, we're receiving 58,000 doses of this vaccine this week, and booking is rolling out 1 birth year at a time. Beginning tomorrow at 8 a.m., we will open up AstraZeneca appointments to Albertans born in 1958 via the AHS online booking tool and HealthLink. First Nations, Métis or Inuit individuals born in 1973 will also be able to book via 811. Individuals who were eligible today will retain their eligibility, and we will be adding this additional birth year, so there will be 2 years eligible tomorrow. We will continue booking eligible Albertans as AstraZeneca supply allows. We anticipate demand and 811 call volume will remain high in the coming days. If you can, we recommend that you book online. You can also try booking during off-peak hours to avoid the rush. I would like to acknowledge that rolling out all COVID-19 vaccines has been a mammoth logistical undertaking. And I want to thank the AHS teams, including Information Technology, HealthLink, Public Health and Immunizers, as well as pharmacies, for making this work possible. If you are eligible to get the vaccine, please do so and encourage your friends and neighbors to do so as well. The more people who become immunized, the less the virus will be able to mutate and the less it will impact our communities. In the meantime, as our vaccine supplies increase and all of us get closer to receiving a dose, please continue to follow public health guidelines in any activities that you do. Even if you have been vaccinated with 1 or 2 doses, all public health orders in place still apply. I know it can be tempting to let your guard down after immunization, but we need to better study and understand the effectiveness of the vaccines in preventing transmission, including asymptomatic and variant transmission, before we can safely alter our policies. We will continue to provide updates on our immunization program here at home and any emerging evidence from around the world that relates to vaccine safety or efficacy. And we will update our guidance as soon as we know it is safe to do so. Thank you, and I'm happy to take any questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First is Kevin Nimick with CTV Calgary. Go ahead, Kevin.
Hi, Dr. Hinshaw. What safeguards are in place to make sure people aren't getting the AstraZeneca vaccine when they might have serious chronic conditions? Is it an honor system?
I want to be clear that the AstraZeneca vaccine is not unsafe for individuals who have chronic conditions. We wanted to be able to offer those individuals the Pfizer or Moderna vaccine based on the NACI recommendations, and those individuals will be eligible, we anticipate, in early April. But if an individual who has a chronic condition wishes to receive AstraZeneca and they're in the appropriate age group, they could choose to do so. There is no requirement to prove that an individual is healthy if they wish to receive AstraZeneca vaccine, and again, they are in the eligible age group.
Follow-up, Kevin?
Yeah, are there particular conditions that you're concerned about that one vaccine might work better with than another?
We're really looking at the National Advisory Committee on Immunization statement, which said, again, when we're looking at the timeline people may have to wait before they get vaccine, that we wanted to be able to offer those Pfizer and Moderna vaccines to those who are older. Again, that's the 2A that's starting next week, and those who have chronic conditions, which we anticipate will be starting in just a few weeks' time. However, we know from the trials that were done in AstraZeneca and from what we've seen in the UK, AstraZeneca vaccine is not dangerous for an individual to receive if they do have a chronic health condition. So again, people just need to be weighing the options that they have and making the best decision that's right for them.
Operator, could you put through the next caller, please?
Next is Julia Wong, Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Bookings for the start of 2A are supposed to start on Monday. However, we called some pharmacies in Edmonton today and found several are already booking for this particular age group. So is the province aware this is happening? Are there consequences for starting bookings earlier than what have been outlined by the province? And what do you say to Albertans who have been waiting to book and now are finding out that others are able to do so prematurely?
It's really important to know that the pharmacies that are currently participating in the immunization program have been given Pfizer vaccine. The reason this is important is that Pfizer vaccine can be stored for many months at ultra-cold storage temperatures, and it can safely be stored for several days at refrigerator temperatures, but only for several days. And so we have been encouraging Albertans 75 plus to book at pharmacies. There are still available appointments. But we've also indicated to pharmacies that if they have doses of vaccine that will be expiring, that they should be using those so that we don't waste that product. And so there may be some pharmacies that have appointments still open that haven't been taken by those 75 plus, and that they would then naturally go on to that next eligible category in order to not waste the vaccine.
Is there a follow-up, Julia?
Yeah, I guess I'm just looking to clarify because Albertans have heard 2A bookings aren't supposed to start until Monday. But if pharmacies are already doing that now, it seems to contradict what the province has previously said.
I want to be really clear that we aim our start dates based on what we anticipate will be the dates when we move from one phase to the next. But in some individual specific locations, there may be, again, all those 75 plus in that particular location who want the vaccine may have already booked either through a pharmacy or through AHS. But if that particular pharmacy has doses, it's critical that those doses not be wasted, and therefore there may be a few days between now and Monday when some individuals who are in that next age group would be offered vaccine in order to not waste those doses. So again, it's not a change from our provincial rollout. It's a strategy that ensures that we're not wasting the very precious doses of these vaccines.
Operator, could you put through the next caller, please?
Next is Lauren Krugel with the Canadian Press. Go ahead, Lauren.
Hi, good afternoon. I was just wondering if there was any update on when the vaccine might be available from doctors' offices. I think there was some mention of that a couple of weeks ago.
We've been working closely with the Alberta Medical Association to put out an expression of interest process for physician offices and primary care networks who wish to offer the vaccine. And so right now we're in that process of receiving those expressions of interest, and then we'll be working with the AMA and with those individual clinics to be able to set them up, make sure that they have all of the appropriate requirements to be able to handle, store the vaccine, and provide appropriate documentation. So all of those pieces are again being worked through, and we anticipate that at some point in April we will be able to have our physician offices also participating in the rollout. But we do need to make sure that we follow all of those steps, because in our influenza immunization campaign, for example, we have a relatively small number of physician offices offering the vaccine compared with a relatively large number of pharmacies. And so we need to make sure for those physician offices that wish to step up for COVID vaccine that we're ensuring all of that infrastructure is in place for that cold storage, for handling, and for the reporting of the vaccines.
Is there a follow-up, Lauren?
I was just wondering, if you can elaborate on the reasons why, the pharmacies are rolling out first. Is it just a matter of infrastructure? Or is there another reason why, the pharmacies are kind of taking precedent at this point?
The pharmacies for several years have been the dominant provider of our influenza immunization program, which means that for the refrigeration cold chain requirements, the reporting requirements, and all of those things that are now part of legal obligations under the immunization regulations, the pharmacies have all of that set up that's used year over year in the influenza immunization campaign. Whereas, as I mentioned, there's a relatively small number of physician offices that choose to participate in that influenza immunization campaign. And so the ability to build off of that existing infrastructure is more readily available in pharmacies. We are very happy to partner with physician offices, and they will be a great addition to our rollout of vaccine to all Albertans. But we do need to make sure that that infrastructure and the reporting requirements are in place for all of the clinics that want to come on board, which is why it's taking a little bit of extra time.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Next is Julie Deviljack with CBC. Go ahead, Julie.
Hi, Dr. Hinshaw. I was just asking about the AstraZeneca rollout for subsequent birth years. What age group are you expecting to get to with the current batch of the AstraZeneca vaccine? And what do you say to people who are closer, let's say above 50, but not quite 64, who expect to get the vaccine in the next couple of weeks?
It's difficult to predict. It really does depend entirely on what the uptake is in each birth year cohort as we roll out the additional years of bookings. So if we see a significant uptake in any one of these years that uses up all of that available vaccine, then of course we wouldn't be able to expand at this time to other years. What I would say to individuals who may be on the dividing line, so would have wanted perhaps to receive AstraZeneca, but we don't perhaps get to that birth year before we use up all of this particular product, is that we are anticipating receiving additional doses in the coming weeks. And ultimately, every Albertan who wants a vaccine will be able to receive one within the next several months. So we will make more vaccine available as soon as we get it, and we will provide those opportunities to all Albertans. But because we have limited supplies right now, we do need to make sure that we are targeting, again, using age as a criteria, and then very soon those chronic conditions.
Is there a follow-up, Julia?
Just with those chronic conditions, when will we be able to know what those are and when that will be expected?
I don't have a firm date on when those will be released, but we, as I've said before, we are very close to finalizing that list, and I know that Albertans are very keen to know what that list is, and we hope to be able to share it soon.
Operator, could you put through the next caller, please?
Yes. Next is Steve Seto with 660 News. Go ahead, Steve.
Thanks for taking my question. I was just wondering if there are any concerns that people may not be booking for AstraZeneca because of its efficacy rate and people wanting to wait for a Pfizer or Moderna shot, and could that increase concerns because of AstraZeneca's expiry date?
We know that a little over half of the doses we received need to be used by April 2nd, and the rest of the doses that we received do have a longer expiry date. And with the uptake we've seen in this first stage group, if that continues, I believe that we will have no issue being able to provide that vaccine to Albertans who want it well before the April 2nd date of that, again, slightly more than half of the doses. And we do have that longer time interval for the other batch. With respect to whether or not Albertans might be waiting for an mRNA vaccine, the Pfizer or the Moderna, it's difficult to say. I do think that we have good evidence, certainly real-world evidence out of the UK, that the AstraZeneca vaccine is effective at preventing severe outcomes in the individual who receives it. So I would encourage Albertans who are eligible for a vaccine to, again, look at the options and then choose the vaccine that they're able to get as soon as they can. And again, there may be some who only have to wait a few weeks for the Moderna or Pfizer and wish to wait, but others who may have to wait several months. The AstraZeneca vaccine does provide that protection for those 2 months with, otherwise they would have had to wait.
Is there a follow-up, Steve?
Yeah, I was just wondering what kind of results you would need in order to for people to get maybe an AstraZeneca dose first and then maybe a second dose of Pfizer or Moderna, being that it has been extended between those two dose shots. I know that you have stated before that, once you get an AstraZeneca shot, you should stick with getting a second dose of AstraZeneca. But what would you need to see in order for that to change?
There are studies underway in the UK right now where they're looking at people who receive a first dose of AstraZeneca and a second dose of Pfizer or vice versa. And those studies will be very, very helpful to be able to determine what the outcomes are of people who receive different types of vaccine for their first shot and their booster. Once we have the results of those studies, we'll be able to make better decisions with those outcomes about how we can offer that second dose to individuals, and we'll be able to offer, again, more information to people once those studies are available.
Operator, could you put through the final caller, please?
Final question is Elise Stolte with the Edmonton Journal. Go ahead, Elise.
Thanks. Hi, Dr. Hinshaw. Can you outline what further outreach Alberta Health is doing to reach seniors currently eligible for the vaccine? One community nonprofit executive just wrote me saying she's found 5 seniors since Thursday who were not aware that they were eligible. Many think AHS has a list and they're waiting for a phone call.
Thank you for the question. We have been working with our partner ministries of seniors and housing, as well as Alberta Health Services, to try to get the word out through community agencies and other organizations that serve seniors. It's unfortunate if some believe that they need to wait for a phone call, so I can certainly take that back and again work with our partners to continue trying to ensure that people are aware that the vaccine is available to those 75 and older. And if there's anyone who has challenges such as mobility issues or who needs supports, all of those supports, again, we are working with partners to be able to provide those to individuals who need it. So this is an important observation. And again, we'll make sure that we're continuing to work with those partners to try to reach all Albertans who are eligible for vaccine.
Is there a follow-up question, Elise?
Yeah, we know that in many jurisdictions, Black and Indigenous people are more likely to mistrust the healthcare system and to decline the vaccine. To what extent is your team relying on general outreach to reach this population versus funding and equipping trusted community health professionals within the community to do this work?
It's a critical question, and we are working very closely with leaders of Indigenous organizations, First Nations leaders, Métis leaders, and ensuring that we are supporting them and working in partnership because the really trusted voices are going to come from within the community itself. With respect to other visible minority groups, again, we have been having some conversations with some of the outreach teams that have been supporting outreach in general kind of COVID precautions to different communities, and that will be we will be enhancing those activities to work with partners who can help us to provide reliable information to different communities who may have historical reasons for not having trust in the establishment, and we want to partner with organizations that serve those communities to make sure that that reliable information is available to them and that any barriers to receiving the vaccine can be mitigated.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.